Thank you, Rob, for joining us today. If you don't mind, let's start by you just introducing yourself and with your role here at Ridgeview.
Hello, yes, my name is Rob Hunton. I am the program coordinator of Outpatient Services here at Ridgeview Institute.
All right, thank you. So, to get started, could you tell us a little bit about what led you to Ridgeview initially?
Well, I began in 1988. I had just graduated school at Mercer University. I was really looking and praying for something that I could start my career, wanted something in the helping field. I really wanted to be able to make a difference in somebody's life. So I was able to apply here, and I was very thankful to get hired on. I heard the founders, really message and goal and mission that I just knew that this was the place that I needed to be. It was passionate, deep passion for mental health and addictive services. So I knew I needed to be here.
Awesome, well, great. That's good to hear. So, could you elaborate on your career here at Ridgeview Smyrna?
Yeah, so like I said, so I began in 1988. I began as a clinical assistant, and I worked as on a PRN basis. I began working with the adult population with mental health. Quickly kind of moved around from the adult to the adolescent program. Then through my time was able to get hired as a full-time, and then quickly advanced to a staff coordinator position on the adult psychiatric program, and did that for a short time. But then thankfully the other opportunities began to kind of develop. I was then able to transfer to the Access Center and work there as a intake assessment clinician. Did that for a number of years, both on the day shift and evening shift. Then transitioned to utilization review. Worked in that department for a number of years. And while working in that department, I was able to kind of venture out and help in other areas of the hospital as well. I did family therapy, got involved with the professionals program that I'll speak about a little bit later. Was able to kind of do several different things, in the helping, teaching, CPI classes, as such. And then after that, then recently this past April, was able to be promoted to the outpatient program coordinator position.
Awesome. So, you've done a lot. So, what would you say are some of your biggest accomplishments that you've had since you've been here?
I've been truly blessed to be here at Ridgeview. It has truly a blessed position to be in. But my biggest accomplishment is just being able to be associated with so many great leaders and the people. It's the people of Ridgeview that has kept me here, and I've been able to learn from. Been some great leadership. Really provided me opportunities to grow professionally and just mature, and be able to really perfect my craft as far as helping people.
Well, I would consider that a great accomplishment. So, thank you for that. So, please explain now the difference between IOP and PHP.
Okay, certainly. Our partial program is typically the program that folks begin at. It's kind of the beginning point of admission to outpatient. It can be a point where patients have discharged from inpatient and step down to our partial program. The program typically is 3 to 4 weeks in the partial program. It's the beginning point of medication stabilization. You're beginning to work on some of your coping skills. Family therapy is highly encouraged with that as well. Lunch is provided. It just gives you the opportunity to see the physician twice a week. It provides opportunity for morning and afternoon classes, process groups, educational groups, and the like. So that's the partial program. IOP is typically a step down from that level of care. IOP is like half day. It's from 9 to 12, Monday through Friday. And this is for our addiction and psych programs. Monday through Friday, and it's kind of a continued stabilization on medication. It still provides some structure. A lot of discharge planning goes into the IOP level of care. We want to get you prepared for discharge. Make sure you have your appointments set up, return to work issues kind of settled. So that's IOP. But we also have, as far as IOP, we have a telehealth IOP program that we offer as well. That's also Monday through Friday as well. Then we have a evening addiction IOP in the evening that's in person, and that's Monday, Tuesday, Thursday evenings from 6 to 9.
Awesome. Well, thank you very much for that. So you talked a bit about some of the IOP programs. Are there any other programs that you'd like to mention as well?
Certainly. But that's what's really special about Ridgeview is that we do offer just a variety of specialized programs, and that's really sets Ridgeview apart from maybe some of the other facilities. Is that we really want to specialize in your treatment experience here. The women's trauma program is just a wonderful, intense program. The therapist is just incredible, very compassionate, knowledgeable. Really, helps patients to really understand what trauma therapy is really about. She uses CBT and DBT, therapies, and they really teach how to talk, about trauma that's in a productive, therapeutic, meaningful way. So we want to provide a environment that's safe, therapeutic, to be able to really get started in your healing process.
Awesome. Thank you. So how about young adults? Can you talk a little bit about that?
Certainly, our young adult program is a very active program. It's 18 to 25-year-olds typically. But it is a age-specific program that allows that community to kind of work together to address all the issues that young adults face today. A lot of family issues, a lot of peer pressure issues that they can address in this therapeutic environment where they can really work together to develop more coping skills, relapse prevention. It's really a dual co-occurring type of groups that really addresses both the mental health aspects as well as any addictive issues as well.
Okay, very cool. Thank you. So let's keep it going. How about addiction?
Addiction is one of the primary groups that we have. It's a very solid program. Highly recommend if you have any issues with addiction, this is the program that you need to be in. The therapist has many years of experience. We have a team that really attacks and the addiction and really in a caring manner really works with the individual to really just enhance their recovery process. We involve the families in it, a lot of education. We want to provide the opportunity to connect with others within the recovery community. We really feel that the opposite of addiction is connection. So we really want to build on that process.
Okay, thank you for that. I think that's cool. The opposite of addiction is connection. I like that. Could you tell us about the professionals?
The professionals has been part of Ridgeview since its very beginning, from the beginning days of Ridgeview. It's a very lively, passionate group of individuals that we are able to really provide those that have licensure issues, nurses, anybody in the medical profession, attorneys, pilots, any of the high-level safety sensitive positions, high-level executives, businessmen. We like for that community to be able to come together. They can relate better together in a group. So we provide groups for that. We work with the licensing board. We collaborate with them to advocate for the individual and returning back to the work in a much better position. Um, and we offer ongoing monitoring and aftercare for those individuals.
Awesome. Thank you very much. And then lastly, how about the adolescents?
Yes, we offer outpatient for adolescent ages 12 to 17. We offer both partial and IOP levels of care for those individuals. And we have a safe environment, two therapists really working with them to provide just that opportunity for them to talk about some of the issues that they're facing, the peer pressure, school issues. And we also have a teacher on staff that will work with the schools to ensure that their schoolwork doesn't get behind and they're able to continue with it in an environment that that's safe, and so they don't get behind in it, and they can continue to also address their mental health issues while they're here.
Awesome. Thank you. Thank you. Now, I think you mentioned this earlier, but what would you say makes Ridgeview so special?
Ridgeview is a wonderful place. It's a place that that healing can really begin. I truly feel that that the spirit of Ridgeview was very deep, and it has deep roots in the community. It's a foundation of the community. People need help, and they need help with mental health and substance abuse. Ridgeview is the place that many have come to receive help and have received help. Through the time here in the community, it's a place that they can come and feel trusted that the staff here truly care about the individuals. We really want to help. They have the same passion as we always have had from the beginning, and we truly want to develop and continue to encourage the community that they come together and support one another and continue to grow so they can really thrive in their life.
Thank you for that. So it seems community is kind of the focal point of it all. So with that being said, could you talk about some of the support groups? Maybe kind of what's the vibe of the groups, and what can people expect when they join some of the groups as well?
Certainly. So in our outpatient program, each evening there's a support group. We have various different support groups each night, from AA meetings to Al-Anon meetings, which is for family members of those that are addicted, have issues with substances, as well as NA, Narcotics Anonymous. We have CA, Cocaine Anonymous, Marijuana Anonymous meetings. We have families in recovery meetings. So every night of the week, there's a support group that you can come and attend. So these groups are open to the community, so anyone is able to come. Some of the topics talked about are about relapse, relapse prevention. How do I get started? Maybe you were encouraged by a family member or work, or someone has mentioned that maybe you have a problem. You're just kind of curious to see what the community is about and how AA works. You're welcome to come and participate in these programs, ask questions, and feel comfortable sitting in the groups and getting a true, honest answer to some of those questions.
Awesome. Thank you very much for all of that. So what is the process for someone who is seeking some type of outpatient treatment?
Well, the initial process begins with an assessment. So calling our admissions department, access center, and you're requesting an assessment, and that kind of is the beginning point. And from that assessment, we're able to really pair you with the right program for you. Since we have several specialty programs, we want to make sure that you benefit fully from that right program, as well as the right level of care, to determine if it's a partial level of care or IOP, or perhaps you need inpatient to begin with. So we'll be able to help determine that. We also will be able to verify your insurance information and any financial obligations as well, just so you know everything up front as far as any barriers for you to get started with outpatient therapy.
Awesome. Thank you. So next, could you talk about the recovery residence and how it plays a role in outpatient services?
Certainly. I also wanted to mention as far as those support groups, if I could. Also, on a Tuesday evening, we have a family education support group that's held virtually, and this is a great program that anyone can log into, with the passcode and the ID number that's on a flyer. You'll be able to get into that group. And just ask basic questions as far as can I get information, or how can I support my loved one? What are the next steps available? What is addiction? Is it a disease? And so being able to ask some of those basic questions, you'll have a better understanding and you'll have a better outcome of really knowing what the process of admissions, what that is, what that's like, as well as what the recovery process looks like.
Awesome. Well, thank you very much for that. That's important. So I'm glad you brought that up. Thank you. So tell us about then the recovery residence.
So the recovery residence is going to pair with that partial program for those that either live a distance away from Ridgeview, where commuting to the program would be really challenging. We provide housing in a safe therapeutic environment that's here on our campus. We provide structure that is staffed while the patients are in the residence. You're able to be there. While in the residence, you would attend those support groups that's held in the evening, and it really builds community. It gives you time away from maybe all the distractions at home. Maybe you do live locally, but your home environment may not be best suitable for you to be in recovery. So it gives you that opportunity, that break from the community, break from home, break from all those distractions, that you can really totally focus in on your recovery to make your recovery the best possible outcome for you.
Awesome. Thank you very much for that. So lastly, is there anything else that you'd like to add, or any other words that you'd like to share with the audience?
Ridgeview is just a wonderful place. It's a place where staff truly cares, truly wants to help. It's compassionate, folks that are here that really want to be able to allow you the best opportunity to really thrive in your recovery process.
Awesome. Well, thank you very much for your time. We'll end it there.
Thank you.